Well, good afternoon, ladies and gentlemen. I know I say this all the time that we have a very special guest. Today is a really, really special guest because he's my son. Now, what we do generally is try to educate and inform the public. And if you watch cable TV, what you see is tons of commercials for pharmaceuticals. Among them is a drug called Ozempic. And they sing and dance and they're happy and all of that. And very few people really know anything about it other than what they see on the cable, other than jumping up and down and being happy. So today, as my guest, is Gregory Dodell, who is board certified internal medicine with a specialty in endocrinology. So before we get into the details, tell us a little bit about your education background and experience, other than the fact that I know you since you're born.
Right. Well, I guess it's obligatory on any of these things to say thank you for having me on your show, on your podcast. But I'd also say thanks for everything you've done for me to get here, life-wise, career-wise. So this is a cool moment. Background is I went to University of Pittsburgh, followed in your footsteps. You carefully, or maybe not so carefully, maybe aggressively nudged me in that direction. Went there, got a great education, went to Albany Medical College after that, and then did all my training through hospitals in New York City. We're affiliated with Columbia at the time, and now affiliated with Mount Sinai. St. Luke's Roosevelt, part of Columbia, and now Mount Sinai, and I do some teaching still through Mount Sinai. And I own and run private practice in the Upper West Side of New York City, both primary care practice and endocrinology specialty practice.
Okay, so what exactly is endocrinology?
Good question. So endocrinology is essentially looking at hormones, how they interact in the body, all the different impacts they have, and different conditions within the endocrine system that we treat. One being diabetes. We also diagnose and manage thyroid conditions, osteoporosis, which is thinning of bone density in women, polycystic ovarian syndrome, also in men, low testosterone. So we do a lot of different things. And really what drove me to become an endocrinologist is the fact that hormones really affect everything in the body. And not only is that interesting physiologically, but when you see a patient not just dealing with one organ system, whether it's the heart or the lungs or the kidneys, really everything that I do and see and treat is affecting people on a systemic level. And we get to follow patients who have acute conditions like new diagnosis, that maybe we make the diagnosis and then we can follow them throughout their lifetime. So I have patients I've been seeing for a decade plus, which is great. And I enjoy that. And you get to know the patient and you get to kind of follow their health and life journey.
Well, diabetes is a very prevalent disease in our world. So for those people who don't know what diabetes is, other than having heard the term, what exactly is diabetes and what's the difference between diabetes 1 and 2?
So diabetes is essentially high blood sugar. There's two types. Well, there's maybe more than two types, but for purposes of the show, there's two types. Type 1 being that the pancreas, which is the organ, which is the endocrine gland that puts out insulin, which is the hormone that helps us utilize blood sugar for our cells to produce energy and things like that, is not being produced. So that's an autoimmune condition, meaning there's antibodies that affect the ability of the pancreas to produce insulin. And the treatment for that is they need to go on insulin medications, whether it's injections or a pump to supply insulin for their body. Type 2 is more common, and that's generally from a condition called insulin resistance. Insulin, again, being the hormone that helps control blood sugar. When there's resistance, it means that our cells aren't able to process the insulin as well, and that causes the high blood sugar. So treatment for that really could be medications in conjunction with behaviors to try and reduce that insulin resistance. If you think about hormones as kind of a lock and key system, the hormones are the key and the lock being the cells. So with insulin resistance, maybe the key, again, being insulin, doesn't work as well at the lock on a cellular level. So you have to figure out how to way to open the lock and kind of manage the blood sugar.
So, we've been watching a lot of television and seeing these commercials about Ozempic. And that's what kind of triggered my interest in having you as a guest, because people really don't know anything about it other than what they see on the various programs. So what is Ozempic?
So you're mentioning Ozempic, but I would also say, and that's maybe just their marketing, Ozempic is one medication in a class of GLP-1 agonists. So there's Ozempic, there's Mounjaro, there's Wegovy. Zepbound is another component of Mounjaro that's approved really just for weight loss. So there's a couple of different medications in that class, just so people are clear that, it's not just Ozempic that has this treatment and this physiology. So Ozempic and really this class of GLP-1 agonists, I've been prescribing and most endocrinologists have been prescribing for a decade plus for type 2 diabetes. It's really only within the last couple of years that they've been used for other indications, primarily, weight loss. And now you're seeing indications for them for sleep apnea. One of them was just approved for sleep apnea. Also data on cardiovascular disease, kidney dysfunction. So there's a lot of different things and indications coming with these medications. But I would just say, that traditionally and the way they got started was really for type 2 diabetes. And the way they work is they slow down digestion. They slow down what we call gastric emptying. So people feel fuller sooner, which may help kind of slow down the transit time and the absorption of blood sugar. It also, in that case, helps people feel fuller sooner. So it may help with some appetite suppression, which is probably where the weight loss is seen, which is really kind of noted as like a side effect or a side note when they're used for type 2 diabetes. They also can help stimulate more production of insulin, which, as we were talking about before, is important for type 2 diabetes because of that resistance. And they also decrease a hormone called glucagon, which can cause blood sugar spikes after a meal, which there's some dysregulation in that if people have type 2 diabetes. So an amazing, great class of medications, if used correctly and monitored and prescribed to the appropriate patient. And a lot of people may say, who's the appropriate patient? And I think that's evolving, based on research and indications and things like that. Obviously, a lot of people are looking at them from a weight loss perspective. And I would argue that, sometimes that may be overprescribed from that standpoint, probably because of culture and all these things. But from a medical standpoint, I use them all the time and they're very effective.
But the real issue is side effects. And I actually went on Google and went on the website for Ozempic, and I was shocked by the potential side effects. And I remember asking you one time about weight loss. If you go off of Ozempic and you've been taking it for a while and you've been losing weight, is there any kind of rebound effect?
So there's definitely the data showing a rebound effect because physiologically, probably the way it's working is it's slowing down this digestion. So people are kind of always a little bit more full than they were before. But it also seems like to be working centrally on receptors in the brain that also deal with appetite. So obviously, like most medications, if you're on it and it's working and you stop it, you lose that effect, whether it's blood pressure medication, cholesterol medication, anything like that. And for that reason, that has to be part of the consideration when prescribing these medications is really generally at this point a lifelong medication for a medical reason, just like you treat any other condition. Obviously, if people are having side effects and whatever, you got to stop it. Then there's the thought that losing and regaining weight, so-called weight cycling or yo-yo dieting or yo-yo weight gain, is actually worse for people health-wise than staying at the same weight. And there is mortality data that shows higher mortality in people that weight cycle versus staying at a higher weight. There's also data that came out of, I believe, the CDC that showed having a higher BMI or a higher weight or height weight ratio later in life could actually be protective for people because they're not frail. is important to protect their bones and things like that, and also not lose muscle mass. So there's a lot of considerations here that need to be taken into account.
So you prescribe Ozempic for your patients?
I have hundreds of patients that take it. I mean, I mostly prescribe it for type 2 diabetes, but it's evolved a little bit in who I prescribe it for. I have women who have this polycystic ovarian syndrome, which is really an insulin resistance phenomenon. So we're using it for that. Other patients who have what we call MASH now. It used to be called fatty liver, but now it's like a metabolic condition of the liver because of insulin resistance mostly, that we're using it for that. So there's a lot of more indications than there were before, but I'm cautious in who I prescribe it for because this is a potential for side effects. It's a long-term medication, so we have to take that into consideration.
How do people take it? Is it like a pill or is it an injection? How often do you take it and why?
So they're all injection. Well, they're injections mostly once a week. There is one pill form of Ozempic called Rybelsus, which is taken daily, which may not be as effective, but there is that pill option. But the other injectables, the Ozempic, Mounjaro, Zepbound, and Wegovy are all once a week injections.
And if you stop, is there any immediate result or is it a gradual, like weaning off of something?
Result as far as do you start gaining weight back quickly? Do you have side effects, that kind of thing?
Yeah.
If you stop it, you shouldn't have any like kind of withdrawal. But I imagine, the weight and the appetite and all these things start coming on. There are these off-label things going on where people are doing what we call kind of micro-dosing it, where they're taking smaller doses of it to kind of maintain things, maintain the weight loss, and then also maybe instead of taking it once a week, they're taking it every 2 weeks. This kind of thing to kind of play with the dosing to still keep it in the system as a maintenance thing, but not stay on the full dose, which has not been studied, from the FDA, but I know people are doing it.
Are there varying degrees of the drug?
Yes, dosing. Yeah. So you
Wow.
start with the lowest dose, and generally after 30 days, if it's tolerated, meaning, most of the symptoms are gastroenterological, so nausea, vomiting, constipation, those things, because it's slowing down the digestion. If it's tolerated after 30 days, then it could be discussed going up on the dose.
And until you reach a certain plateau, or is there some?
It depends what the objective is. So I have a patient today I saw with type 2 diabetes. He's on the lowest dose of Mounjaro, and his A1C, for people listening, this 3-month blood sugar average we use as kind of a marker for overall diabetes management and control. His A1C went from not being at goal to being at goal, and he's on the lowest dose. And we both said, perfect. There's no reason to increase it. You're feeling good. Your levels are great. Keep it as is. But some people require higher increments, higher doses to get to goal.
How do you know when to increase the dosages?
I go by the A1, but usually by the A1C, or if someone's wearing a continuous glucose monitor, which are the monitors that many people see, on the arms, these kind of like either white circular things, which is the Libre, or the Dexcom, which is a more elongated one, and people can have access to their blood sugar 24/7, and we can use that data to kind of see how the medications are working.
Well, I made a list of various things that are called side effects. And I noticed, what about women that are pregnant? Is that a medication that should not be used, or is there any data on it at all?
You absolutely cannot take it during pregnancy, and you're supposed to stop it at least 2 months before trying to get pregnant.
Why is that?
Most of the data on pregnancy and medications that say they're contraindicated, probably because it hasn't been studied in pregnancy. But just knowing the physiology of the medication, I probably would say it's probably not a great medication to take in pregnancy, because if people aren't getting enough calories or they're getting malnourished or it's affecting digestion and things like that, that's really not something you want to be happening during pregnancy. People need to be getting calories and nourished and things like that.
There's also a reference to something called retinopathy.
Right.
What exactly is that, and how is it affected by Ozempic and its progeny and the other medications?
So retinopathy is the premise of it is the retina. So it's a disorder of the retina, vasculature, the blood vessels that can be damaged through longstanding diabetes if it's not controlled. And then there was some data coming out about like ischemic retinopathy, meaning not enough blood flow to the retina from these medications. So it's important to certainly get at least annual blood ophthalmology exams and make sure everything looks okay with the eyes.
It also refers to the possibility of an effect on the pancreas. How does that work?
So the medications work through the pancreas by stimulating insulin, but there is pancreatitis, which is inflammation of the pancreas, which may be also a side effect. So that's another thing. If patients have significant nausea, vomiting, abdominal pain, the medication should be stopped right away and they should be evaluated for pancreatitis.
And I noticed that it talked about thyroid. Mm-hmm. What effect does this medication have on the thyroid and medication that's being taken for the thyroid?
So there was some animal studies, maybe I think rodents or something like that, looking at thyroid, and they saw an increase in medullary thyroid carcinoma, but that hasn't been replicated in human data and human studies. But patients that do have a family history of this very rare medullary thyroid carcinoma, that's a contraindication of taking the medication. People who are on thyroid medication, because it can affect the absorption of the medication itself because of the transit time of the colon, their doses may need to be adjusted. So it's important to keep an eye on the thyroid levels while they're on the medication.
So there's been reports of carcinoma affecting the thyroid?
Not in humans.
So that's still an open
animal studies.
What about effect on the kidneys? People who have kidney issues in their life. How does this drug affect that?
So the data seems to be supporting kidney protective feature of these medications, probably along the lines of improving diabetes control, improving blood pressure, all those factors that affect the kidneys. So there seems to be a protective effect on the kidneys.
So it has a positive effect.
It seems to be.
I also noted it said that there's something called a surgical complication. What exactly is that?
It says what?
Surgical complication.
Surgical complication from the medication?
Yeah.
I don't know specifically, but I do know that you're supposed to stop the medication at least a week before surgery because there's an aspiration risk, meaning that everyone knows before you go for surgery, you're not supposed to eat or drink anything other than water, like after midnight the night before, because you need an empty stomach. And if you have anesthesia and your stomach still has food content in it, it's an aspiration risk where the food can come up and go into the lungs and cause pneumonia and other respiratory complications. So it is recommended, at least at this time, to stop it at least a week before any kind of surgery or colonoscopy or procedure.
But it also refers to people that have allergies. Does this drug have any effect on people who have allergies? And I know allergies is a very broad term. Can it affect people who have allergies, whether it's hay fever or what?
I haven't seen anything on that.
How about the stomach?
The stomach is the main thing that we see as far as side effects.
And what do you do about that? You just stop the medication, or?
Yeah, so if they're on a higher dose, you can try and reduce the dose. You want to make sure that they're staying well hydrated, that they're having adequate fiber in the diet. And yeah, if it's a persistent problem, then you have to consider stopping it.
What about dietary people who have food reactions? Is Ozempic and drugs like that affect uh, eating issues?
What do you mean? Like food allergies?
Yeah,
Shouldn't.
should not.
Should not.
No difference.
No difference.
And I also noted it refers to the possibility of a lower blood sugar. What exactly does that mean, and what do you do about it if your blood sugar gets to be too low?
Right. So if you're taking one of these medications, usually in conjunction with an insulin medication, which is injectable insulin, or other medications like these sulfonylureas, they're called glipizide, glyburide, glimepiride are the most common ones. Because of the way that the GLP-1s are working, it may cause a low blood sugar just because of the absorption of the sugar and the effect that it has in conjunction with insulin. So it's important to be on the lookout for those and know the signs and symptoms of low blood sugar, which could be shakiness, sweatiness, confusion, irritability. Those are signs of low blood sugar. So for people that don't have a continuous glucose monitor or don't check their blood sugar, they at least have to know the signs and symptoms and should certainly carry something with sweets with them, with sugar with them, whether it's raisins or glucose tabs or chocolate, just so that if they feel those effects, they can have something and be prepared.
So that raises the sugar level.
Correct.
So having a candy bar is going to up your sugar level if you have it too low.
Correct.
So you could prescribe a Hershey bar or something for those
Exactly.
people.
Exactly.
I also noted in the advertising material, it says it is not known if Ozempic is safe and effective for use in children. What can you tell us about that?
Yeah, I mean, there's a lot of discussion, and I think they are starting to use GLP-1 medications with children. I don't see kids, so as a doctor, so I don't have much to add anecdotally from taking care of kids on these medications, but I would say I have some reservations on that because kids need to be nourished, they need energy for growth and development, and being on these medications may hamper those things. So I think you have to be very careful to make sure the kids are getting the nutrition they need to grow and thrive. And there's also probably a lot of stigma with being on these medications and changes in weight and things like that. So again, I'm not a pediatrician, but those are my concerns.
What about using Ozempic and drugs like that? If you're already taking medication for diabetes, like metformin?
Yeah, no, they're used in conjunction with those. Sometimes starting one of these GLP-1 agonists, in addition to those, over time, you may be able to stop the other ones, which I see fairly often, as these medications kick in because they have a multitude of ways that they work, you may be able to stop the other ones, which a lot of people like, because if you take a once a week injection and you get rid of taking 3 or 4 potential pills a day as metformin or something else, it's maybe more convenient and it's effective.
Other than the side effects that we already talked about, can you think of any other reason why somebody should not be taking this kind of medication?
I think I'm a little wary of using it in a senior or geriatric population just because of the potential for muscle loss. I think is significant. I think we're going to maybe start seeing data that goes with the muscle loss and also loss of bone density, risk of certainly dehydration, risk of gastrointestinal side effects. So I think, in an older patient, I think you have to be a little more cautious in using the medication. Again, it's not contraindicated, but I think you have to look at side effects when you're using any medication, and that is the same with this.
What effect does hydration have? Because you've mentioned being dehydrated. What's the effect of being dehydrated? Because you hear all the time, drink a lot of water, athletes should drink a lot of water, etc.
Right.
What effect does hydration have on the body?
So hydration seems to be important also for insulin resistance. So being dehydrated may induce insulin resistance. It can cause low blood pressure if someone's dehydrated. It can affect kidney function. If someone's dehydrated, it can affect electrolytes like sodium, things like that. So it's really important to stay hydrated.
So overall, if you had to summarize it all, would you recommend Ozempic and others like it for just weight loss?
It's a tough call, and I think it depends on the individual patient. I don't necessarily prescribe it for just weight loss. I'm prescribing a medication for a metabolic indication. So again, if there's type 2 diabetes, if there's some evidence of insulin resistance at the liver or other signs and symptoms going on, high cholesterol, high blood pressure, sleep apnea, things like that, I think it's a reasonable and important discussion to have. But I don't like the blanket statement of like a yes or no, black and white. I take this conversation with patients seriously because of potential side effects and the fact that I'm intending for them to be long-term medications. So just like any other medication, it's a discussion, and you got to look at the person in front of you, and you can't just before they walk in the door say this is someone who's fat and they need to take this, because to me that's not medicine. You got to look at the overall picture.
And labs, I know that you read a lot of lab reports.
Right.
You told me that. What does the lab report tell you in terms of prescribing a drug like Ozempic?
Right. So we look at the blood sugar average, A1C, and look at cholesterol. We may look at insulin levels, to see if there is insulin resistance, liver function, kidney function. Those are the main markers we look at.
So you get, would you say you get most of your information from the lab reports from getting blood tests?
Generally.
How often should you get those blood tests done?
It depends on what you're being seen for. I mean, people with diabetes, we do it every 3 to 6 months. If someone has high cholesterol or high blood pressure that we're following, probably twice a year. If someone doesn't really have any metabolic things going on, they should probably get at least a full panel once a year.
What effect does this drug have on people with high blood pressure? Because a lot of the people who are watching these podcasts experience that situation. Does this have any effect on it, either lowering it or increasing it?
I think I do see that it lowers blood pressure. There's probably a lot of different reasons for that happening, but it does seem to have effect on blood pressure.
Why is that?
It may be associated maybe with eating differently. It may be a change in weight. Unclear, but it may have an effect on blood pressure. It's not indicated for blood pressure or hypertension at this point, but I think it probably does play a role.
So overall, are you okay with prescribing this drug? Obviously, you are prescribing it. So
I mean, I probably prescribed it to 5 people today. Every day I prescribe it, but it's a discussion, and I tell a lot of people, because of the marketing and the commercials and all this stuff that you led with, I don't give it to every patient who asks for it. I don't, a lot of people come in here and say, I got my wedding coming up. I just had a baby and this and that. And I kind of have to say, look, I'm looking at it for these metabolic reasons. There's a lot of side effects. Let's try other behaviors and things like that. Let's monitor your labs. At this point, I don't think it's indicated, but let's keep the discussion and the dialogue going and go from there. So not everyone that walks in the door gets a prescription.
So if somebody wanted to consult with you, how would they get in touch with you?
They would go through our website usually, or call the office. The website is centralparkendocrinology.com. I'm sure you'll have some show notes or something. And my phone number, and then I'm on Instagram also. Not to book an appointment, but for other information like this.
How many patients do you think you're seeing every day?
I see on a full day between 20 and 30.
Wow. Busy boy.
Yeah.
Okay, well, of course, I'm going to thank you because I think you've given us a great education on a very important topic that's really current. And I'm sure people are going to have questions about it. And getting in touch with you, will you be able to respond to some of these people?
Yeah, they can find me on social media, or if they're in New York, they can contact the office if they want to come for a consultation.
Okay, so thank you.
All
I
right.
know you and I have been talking about you're doing this for a while, and I want. I know you were a little reluctant to do it to begin with, but I guess somehow either me or your mother uh, convinced you to do it. So
No, I just wanted to make sure that it made sense for your audience, but I think the way you phrased it does make sense.
okay, so I will certainly talk to you very soon. Thanks again, Greg.
All right, love you. Bye.